In this video, we'll discuss about facial hemihypertrophy. So, as the name suggests, it is basically going to be an overgrowth, whereas it is going to be an overgrowth, asymmetric overgrowth of one or more body parts. Now, one thing is that it has hypertrophy in its name, but it represents more of hyperplasia than the hypertrophy. Now, most of the cases of facial hemihypertrophy, the isolated cases of hyperplasia are mainly sporadic. Now, coming on to the classification. In the anatomy classification, what we have is we have three types. The first one is the simple facial hemihypertrophy, then is the hemifacial, and then is complex. In simple, what we see is there is an involvement of the single limb, whereas in hemifacial, half of the face is involved. Now, this includes half of the body, affected parts, contralateral or ipsilateral. Now, coming on to the etiology. Now, in etiology, there can be certain vascular or lymphatic abnormalities, Then there can be chromosomal abnormalities. Then CNS disturbances. Now coming on to the clinical features, what we see is first of all there is unilateral macroglossia with premature development. Then in skin, what you get to see is in skin we see that there is thickening, increased pigmentation, then nevus, flamus. Also, there is one more thing, hypertrichosis. Then there is excessive excretion by the sebaceous glands and sweat glands, excessive secretion by sebaceous glands and sweat glands. Also, asymmetry is also seen. Now, asymmetry is mainly seen in bones such as palate. Then we have alveolar process, frontal bone. Then we have mandible, maxilla. Now, coming on to the oral manifestations. In oral manifestations, what we see is that the dentition is affected. Dentition is affected by crown size, root size and shape, also rate of development. There will be an increased size of the crowns. Also, then there will be rapid eruption. Then the roots will be larger. Now, a very important thing to remember in oral manifestations is about tongue. In tongue, what we see is there is the enlargement of the tongue, as I told before, then enlargement of the lingual papilla, plus general unilateral enlargement and contralateral displacement. Now, the buccal mucosa, it appears to be velvety in texture and it has soft pendular folds. In histopathology, what we will see is we will see excessive thickness of epithelium and hyperplasia of underlying connective tissue. Now, in case of treatment, there is no specific treatment. However, there is certain cosmetic procedures that can be done, cosmetic surgery, which are done basically after cessation of growth. Also, we need to assess the abdomen, periodic abdominal ultrasound, MRIs to rule out the tumors, then orthodontic therapy.